welcome everybody to the first virtual dog health workshop. I think one of the most exciting parts of this is in the past, at each of the workshops, we've always been excited to attend and so forth, but we always lament the fact that 2 years have passed and did we really get much accomplished in the interim? And I think that this is a great effort to make sure that we keep the momentum going forward. Continue to remain in touch and continue to make improvements for our dog's health. So this morning, I'm going to be speaking on the BOAS program here in the US and Canada. And pretty much we typically refer to North America, the two countries. Everything that's happening in one is happening in the other. So they're really not separated. And just to
Excuse
give
me, Andy, I'm sorry to
Yes.
interrupt you. Your slides are not in presentation mode.
Okay. I'm glad you said that.
You're doing a great job, though.
Thank you for the feedback. How about now?
Perfect. Thank you.
All right. All right. Thank you for that. And so for those of you that are joining the session from the UK, a lot of this might already be familiar to you. For those of you here in the US or Canada that have brachycephalic breeds, hopefully this is familiar to you. But for everybody else, it's going to be sort of a nice introduction of what's going on. So brachycephalic obstructive airway syndrome, more commonly known as BOAS. All of us purebred dog owners and breeders, we are constantly answering questions and criticisms that our dogs are supposedly unhealthy due to generations of inbreeding. And as a generalization, I think we can all agree that this is not necessarily the case. However, we also have to be honest with ourselves and understand that there are certain breeds which are predisposed to certain heritable conditions. And often these predispositions are based upon extreme anatomical traits which have been achieved through selective breeding practices. So the breathing issues associated with the brachycephalic breeds is probably the most current hot button issue that's being discussed out there. And a lot of that is probably due to the growing popularity of the affected breeds, Frenchies in particular. So when we look at dogs as a species, dogs are unquestionably, they are the most genetically engineered species on Earth. And we can see that on that left-hand picture of the tiny little Chihuahua right next to the giant Irish Wolfhound. Those are the same, they're dogs, right? But how vastly they different are. And we can also see it on the right when we've got the headpieces of the Borzoi and the pug, that extremely long, narrow head that we associate with the Borzoi. And then, of course, what we're going to be speaking about a little more today, the brachycephalic or shortened head of the pug. So again, human selective breeding created these very, very different skull shapes, from the dolichocephalic that we saw in the Borzoi to the middle ground, and then all the way on the right, the brachycephalic skull of the pug. So when we talk about BOAS, brachycephalic obstructive airway syndrome, what is it? So it's a condition, it's a group of different conditions which may cause breathing difficulties in these breeds. Most commonly, we think about bulldogs, French bulldogs, and pugs, although it can certainly affect other breeds such as English Toy Spaniels, Brussels Griffons, etc. But again, mostly those three breeds are the ones that we think of when we think of BOAS. And what causes BOAS? So it's caused when the soft tissue in the nose and throat are excessive for the airway and partially obstruct the airway, making it difficult for them to breathe normally. The clinical signs of BOAS, they're sort of what we think of, I don't think there's any surprises here. Primarily the noisy and labored breathing. But also exercise and heat intolerance, regurgitation, and difficulty swallowing. And what are the impacts of BOAS? BOAS is a progressive disorder, and it can impair the dog's ability to exercise, to play, to eat, and to even sleep. So I think you can summarize it in general. BOAS impacts the dog's quality of life depending upon the severity of the disease. Unfortunately, many owners are completely unaware of the disease and just often interpret the breathing difficulties or noises as simply normal for the breed. And even as a lifelong dog person, having been involved with dogs since my early teens, at one point in my life, I got a pug for my sister. That pug definitely had some symptoms of BOAS, and we didn't think anything about it. We just assumed it was the normal condition for the breed. Those noises were difficult. The heat intolerance and sensitivity was normal for the breed. And when I look back at this stage of my life, I really feel terribly guilty that I fell right into that trap of thinking that it was just normal for the breed. And so now with the soaring popularity of some of these Brachy breeds, Frenchies in particular, BOAS is absolutely gaining more traction as a concerning health and welfare issue that we need to talk about more. So we've already discussed a little bit what is BOAS, and I think specifically some more specific conditions would include stenotic nares, elongated soft palates, averted laryngeal saccules, tracheal hypoplasia, or even tracheal collapse. Now, how is BOAS treated? Mild cases are generally done through weight management, improving the dog's body condition, making sure that we avoid excessive heat for the dog, controlling their activities and their exercise, and minimizing stress. And in more severe cases of BOAS, unfortunately, it's often going to involve surgical intervention. That can involve correcting the stenotic nares, removing inverted saccules, shortening the soft palate, and unfortunately, there is no surgical correction available for tracheal hypoplasia. And of course, we also always need to remember that all surgeries come with inherent risk. To the right there, I've got a recent screen print. This is pretty new news. And if you look at the date there, May 2nd, but there was just recently a fairly large size grant, $150,000 that was issued to Dr. Kelly Thyman at Texas A&M by the AVM Foundation. And the research project is titled Evaluating the Effect of Weight Loss on Respiratory Function Grading and Whole Body Barometric Plethysmography in Brachycephalic Dogs. So what Dr. Thyman is going to be researching is what is the effect on improving the dog's weight and body condition in terms of dealing with BOAS symptoms. So we're looking forward to that. And as a side note, Dr. Kelly Thyman is one of our initial 2 assessors for the respiratory screening program here in the U.S., working directly with Dr. Ladlow at Cambridge. And for those of you who might be attending the AKC Canine Health Foundation's conference later this summer in Raleigh, Dr. Thyman will be one of the speakers there. So basically, what's this path? I just mentioned the respiratory function grading scheme. And so for the last decade or so, probably the researchers at the University of Cambridge have really been on the forefront of dealing not only with the condition, but in terms of improving the public perception and so forth that's associated with BOAS. And in turn, they developed the Respiratory Function Grading Scheme, the RFGS. The goal of the Respiratory Function Grading Scheme was to develop an
Thank you.
objective test to measure the clinical diagnosis and severity of BOAS. They launched their program back in the UK in 2019, and the OFA has since joined the international effort and has licensed this program for use here in the US and Canada. And we began our pilot in 2022. So let's talk a little bit about the exam process itself. So there's basically 4 steps, and we'll talk about each one a little more in depth. But there's an initial survey. There's an auscultation to listen for the dog's breathing, and this is done to basically set a baseline. There's a short period of exercise to stress the respiratory system a little bit. And then following that, there's going to be another auscultation that we can then compare against the baseline. So let's talk about that a little further. So initially, we're going to do just a survey with the owner. We want to just find out initially if there's been any kind of episodes of collapse, aspiration pneumonia. What is the owner's assessment of that dog's breathing capability, whether at rest or after exercise, in hot weather, etc.? Has that dog had any kind of negative GI signs, such as regurgitation or vomiting? And how would that owner generally characterize the dog's ability to tolerate exercise? A big reason that we want to do this initial survey is we want to eliminate from the exercise portion dogs who have had a bad history of severe exercise intolerance. We don't want to make this to be a bad experience. So next, we're going to have a brief physical exam on the dog. We're going to observe the dog's nares to see if there's any kind of stenosis. We are going to do an auscultation where a stethoscope is gently positioned on the side of the neck, and we're going to listen for any clinical signs of the BOAS condition. Following that, we're going to do a short exercise test, which consists of a brisk 3-minute walk. Ideally, we're targeting anywhere in the neighborhood of 3 to 4 miles an hour. And I did a quick conversion before I got on here, and I believe that's about 6.5 kilometers an hour. That gives you a feel for the speed that we're looking. So we're not running with the dogs, but it's definitely a brisk walk. Right? We want to do this for about 3 or so minutes. And this is designed to expose the clinical signs of the disease in an otherwise calm and asymptomatic dog. We're just trying to stress that system a little bit. This is not designed to assess the dog's cardiovascular fitness. And then following the exercise portion, we're going to repeat the auscultation on the dog after increased airway activity. Compare that to the previous baseline and see if there are any kind of airway noises that we are hearing. To give you a feel, this is what the exam form looks like. Here in the US and Canada, we also have a paperless online version of this, which is quite nice. The owners can register prior. It establishes a case, and then the assessor, based upon that case number, can pull everything up online and complete all the information that you see here on this form. They can enter that online in that tool. But in order to make this a better visual, we've posted up here what that exam form looks like. So we're capturing obviously the demographics on the dog, their information, the owner's name, etc. Under the terms, I do want to point out that we do include a certification that the owner is signing off that this dog has not had any kind of corrective surgery on their respiratory tract. Obviously, if the dog has had surgical correction, it kind of makes this screening program a little bit null and void. So there's no point in that. So we do ask the owner to certify that the dog has never had any kind of corrective surgery. As we go below, then there is a veterinary section, and this is where the examiner is going to complete both pre-exercise and post-exercise. There are observations in terms of the dog's respiratory patterns, any kind of inspiratory effort, and here's kind of the big pieces. They're going to record any kind of stertor or stridor noises that they hear. Again, non-audible is ideal. Mild, the dog is probably still going to pass. And as soon as we get into any kind of moderate or severe noises, we're probably looking at an affected dog that is not going to pass the screening program. Again, we mentioned what are the types of noises that the examiner is looking for: stertor noises, stridor noises, and the same in terms of nasal stertor and stridor. Now, how are these dogs actually graded? So it utilizes a scale of 0 to 3. And again, this was developed by the researchers at the University of Cambridge. Grade 0 is typically given to dogs that are completely clinically unaffected by BOAS. They're free of any kind of respiratory issues, no evidence of disease, and basically we're not hearing any of those stertor stridor noises associated with BOAS. A grade 1 dog, we're still calling these dogs clinically unaffected, but there may be some kind of mild respiratory signs linked to BOAS. If there are any kind of audible signs of stertor or stridor noises, it's typically only audible with the stethoscope and not without. Dogs that are graded 2 and 3, we are calling these dogs clinically affected, as there is either moderate or severe respiratory signs of the disease, and the noises, the stertors and stridors, are often audible even without a stethoscope. Here's a more detailed look at that matrix, and you can go on the OFA website and you can find this. You can also find this in the respiratory function grading scheme sections of the Royal Kennel Club, as well as the University of Cambridge, talking about BOAS. But it basically gives you the matrix of what the examiners are looking for and how they would in turn grade those dogs. And this is very important to make sure that we've got consistency amongst the examiners, whether that exam is taking place here in the US or in the UK or any other place where these grading scheme exams are being used. Here's a matrix on breeding recommendations. And again, we referenced the 0 to 3 grading scale. 0s and 1s are clinically unaffected. Grades 2 and 3 are clinically affected. No surprise with the unaffected dogs, grades 0 and 1. you're green to go. So you can breed a grade 0 to a grade 0, grade 1 to grade 1, no worries there. As soon as you introduce a grade 2 dog into the breeding pair, we get yellow. So basically caution. So you are definitely increasing the risk of producing more affected puppies, and certainly grade 3s to grade 3s would always be a red zone, a definite concern for breeding, definitely not recommended. The list of BOAS examiners. So again, we referenced the fact that we began the pilot program for this back in 2022. And so we have grown the list of examiners here in the US. There's currently 29 here in the US and another 8 in Canada. This has been a real challenge, and I'll talk about that a little further in a little bit. But to get this list simply large enough where, regardless of where you live, that you have access to one of these examiners is not that easy. And if you look, we do have definite concentrations in geographical areas of our country, as well as up in Canada, where you can even find an examiner to do this exam. Here's probably what you guys are the most interested in. So what do the statistics look like so far? So from inception, again, we began the pilot program back in 2022, and we officially began scoring dogs and capturing those data in 2023. So in the 2.5 years that have passed, we here in the US and in Canada have conducted a total of 891 of these respiratory function screening tests. Of those, 649 dogs were graded either 0 or 1, so they were clinically unaffected. That's 73%. 242 dogs were graded as being clinically affected. That was 27%. There's obviously bias in this program, in these numbers, in terms of these are dogs that were typically presented for exams at clinics which took place at either dog shows or specialties. So whether it was an all-breed dog show or a specialty show for bulldogs, Frenchies, or pugs. So I think it's fair to say that given the dogs that are attending the shows and being shown, hopefully those are the best of the best, and they are not suffering the same levels of clinical signs of BOAS. I would suspect if we took a more random population, although I don't have the statistics to back this up, but I would suspect if we took a more random population of bulldogs, Frenchies, and pugs, just a cross section of pets that are available, we might see the affected statistics go up a little bit, those percentages. That's a guess. But again, this is what we saw from the dogs that presented to us. Also, there's that other column over there. So there's a handful of breeds here, in particular in the US. I don't know if this carries over to other countries or not, but here in the US in particular, the owners of English Toy Spaniels and Boston Terriers have almost embraced this test to the same level as the traditional breeds that we associate with this, maybe even a little more, in particular the Boston Terrier people. So that's why we see some pretty large numbers in the other column. And but those dogs in that other column, they were also overwhelmingly unaffected. We can look at that percentage, 91%. So when we looked at the total column again, that's 73% unaffected, 27% affected. What would happen if we stripped out the others, the Boston Terriers, the English Toy Spaniels, and some of the other breeds that were tested, and we looked only at bulldogs, Frenchies, and pugs? And if we did that, our normal unaffected grade 0s and 1s is going to drop from 73% down to 67%. So not a huge difference, but it does show that when we focus strictly on those 3 breeds, we are going to see a higher incidence rate of clinically symptomatic dogs. What are some of the challenges that we faced here? And I think that when we licensed this program from Cambridge and the Royal Kennel Club in the UK, this was a real learning experience. So one of the biggest things that we encountered right off the bat was, in terms of challenges, was geography. All right. So the sheer size of North America that we were dealing with, the US and Canada compared with the UK, made it challenging to train examiners and get those trained examiners evenly dispersed geographically. So no matter where you lived, you hopefully will have access to one of those examiners. And we are still very, very far from achieving that goal. Climate was another big challenge for us. So in the UK, from what we understand, most of the exams are actually done outside in a very temperate climate environment. Here in the US, we have a lot of challenges, especially if we're trying to do these exams anytime in the late spring, throughout the summer, and even the fall, where we have conditions where it's going to make it basically impossible to do these screening clinics fairly in an outdoor environment. So we're typically looking at having indoor climate controlled environments to avoid difficulties due to heat and humidity. Acceptance. This is a big one for us that we're still struggling with, and it was a little bit of a surprise. So while the three parent clubs, the Bulldog Club of America, the Pug Dog Club of America, and the French Bulldog Club of America, have all enthusiastically embraced the availability of this test, widespread use of the test, even amongst their membership, still seems to be lacking, which is definitely disappointing. We're doing what we can to try and break through, but everybody was excited about it when it was first released. And now that the test is actually there and available, yeah, the excitement seems to have waned a little bit. Training is another challenge for us. So I've already mentioned that getting enough examiners that are located all throughout the two countries to make them available to everybody is difficult. And that is in large part because they need to be trained. So while any licensed veterinarian basically should be able to do these exams, we definitely want them to go through a shadowing experience, a training experience with an approved examiner to help make sure that we can ensure consistency amongst the exams and the exam experience. And so finding these training opportunities to approve new examiners is difficult because we need to make sure that there's sufficient dogs of different breeds and different grades to make it a meaningful training experience. What we found lately is that the best way for this to happen is to not wait for a clinic to happen, but if we've got a particular veterinarian who's very interested in becoming approved, and they come to us and they tell us that they've got enough of a client base in their clinic or their practice, that they think that that it's a value add scenario for their clinic. We ask them to go ahead and schedule such a clinic to make sure they get sufficient dogs recognized. And then we will make sure that we can get one of the existing approved examiners to come there to conduct the actual exam so that vet who did the organization can then do the training experience and the shadowing experience under the approved examiner. And the other thing that we're going to have happen for the first time this summer is sort of a wet lab concept. I think that this is also what they do with this program in Australia, from what I understand, where they have a group of dogs who have been examined, they have been graded, and so we already know that dog's particular status. And these owners of these dogs are willing to bring them to training sessions so that we can know up front, here's the number of dogs we're going to have, here's the cross section of breeds that we're going to have, and here's the cross section of grading results that we're going to have. So at the Society for Therogenology annual conference later this summer in Sacramento, I believe it's going to be this year in August, they are going to have a lab experience, a training experience where they've got the dogs already lined up. They've already gone through and graded them. And so they're going to be offering this as a training experience for veterinarians that are attending the SFT conference this summer. Consistency is another challenge for us. So while we don't so much worry about the inter-examiner reliability, consistency in the exam protocols continues to be something that is a bit of a challenge to us. So whether the exams are being done indoors in a completely climate and controlled environment, or whether they're being done outdoors. And if they're being done outdoors, is it sufficiently cool and is the humidity low enough that it's not affecting the dogs? So the overall temperature and humidity are concerns. Speed. It doesn't seem like it's a big deal, but when we walk, even if you describe this as a brisk walk, what may be a brisk walk to me may not be a brisk walk to you. So when we do these, we try and use web apps on the phone so that the dog walker is actually able to monitor and keep track of how fast they're going, so that we don't fall below that 3 to 4 mile per hour goal, right? Um, Also, who walks the dog? May not seem like a big thing, but initially in the rollout of this program, we realized that the dogs may be very compliant to walking with anybody, and we may have other dogs who don't want to walk for anybody but their owner. Then what do you do if you have an owner who is perhaps not as fit and they're unable to walk at that 3 to 4 mile per hour thing? So then you put the dog with a dog walker, and the dog does not want to walk for that person. So these are little things that we never even really thought about or anticipated up front. But as soon as you do a couple of these clinics, you're going to run into these scenarios. Remember that as part of the exam process, we have a pre-exercise auscultation and a post-exercise auscultation. And that is hopefully happening in an area of this clinic setting where things are nice and quiet and calm, so we don't stress the dog out, and to also ensure that the veterinarian can properly hear. Um, again, in terms of just mere consistency, is the owner present during that auscultation, or is the owner in another area of the clinic? Um, and how do you ensure, like one owner, if they notice that another person got to go back with their dog and they weren't invited to go back with their dog? So these are some little minor differences in the exam protocol, but we quickly learned that owners pick up on this, and they can get up quickly pretty upset if they feel like their dog wasn't treated fairly and their dog wasn't given the absolute best opportunity for the best possible outcome. Finally, another one that I mentioned there is just semantics and perception. So when we began the program, we used this term that we're all relatively familiar with now, BOAS, Brachycephalic Obstructive Airway Syndrome. What we also quickly found out is that as people become more familiar with this term has a lot of negativity associated with it. And as such, we even found some kennel clubs and so forth that were resistant to wanting to offer BOAS exam clinics at their events, because they felt that it highlighted or called attention to some of the inherent health issues that purebred dogs are dealing with. So it may seem like a relatively minor thing, but in all the exam paperwork, in the website materials, in the program itself, we removed all references where we could to BOAS, to Brachycephalic Obstructive Airway Syndrome, and we try and only refer to this as the respiratory function grading scheme, which still perfectly describes what we're there to examine, what we're there to grade, what we're there to capture data for, but hopefully removes a little bit of that negative perception that's associated with BOAS. This is just another quick, a nice visual reference. Just when the assessors, when they do that first exam of the dog, they are asked to grade whether or not they see any evidence of any kind of stenosis. And so this is sort of a nice grading chart, but it's also interesting that as this program has gained traction, they have definitely noticed that there is not a one-to-one direct correlation necessarily between any visual evidence of stenosis and what the grade is going to turn out to be. So we have absolutely seen dogs that have even mild or moderate stenosis and that are getting grade 0s and 1s. And we've seen the reverse happen as well, where we have some dogs that have had nice open nostrils, but end up getting grade 3s, 2s or 3s because of other issues that are associated with the BOAS syndrome.